Great, thanks, Delia. Good morning, I'm Patrick Allen, Director of the Oregon Health Authority, and as Delia indicated, I'm joined today by Dr. Dean Seidlinger, our State Health Officer, and Dr. Melissa Sutton, who oversees our COVID-19 testing program. Today, I want to give you the latest information about vaccinations in Oregon, including the updates to our eligibility timelines, which Governor Brown's office announced earlier this morning. Dr. Seidlinger will give you an update on the state of the pandemic and the latest on variants. Finally, Dr. Sutton will update you on our testing capacity, where we stand in relation to the rest of the nation in testing, and our COVID-19 positivity rate. Then we'll be happy to take your questions. In a week in which Oregon passed the milestone of administering primary doses to at least 1 million people, two main points I want to talk to you about today are, first, Oregon's recent high rate of vaccinating seniors has put us closer to most other states in the percentage of seniors who've been immunized, but some counties continue to lag. Second, this week, Oregon received more than 24,000 doses of the Johnson & Johnson vaccine, plus doses going directly to pharmacies in the federal program, but that amount was approximately 40,000 doses less than we expected. We still expect to receive sufficient supplies of doses from the federal government to hit the new eligibility timelines Governor Brown just announced. Despite the disappointing shortfall in Johnson & Johnson, the numbers continue to show that our total supplies will be adequate to vaccinate all Oregon adults by early June. Now let's look at the numbers. As of today, 1,073,369 Oregonians have received at least one vaccination. That total represents 8 in 10 of the approximately 1,317,000 people who are currently eligible to get vaccinated in Oregon. Overall, 25% of Oregonians have received at least one shot. The national average is 26%. Oregon is currently averaging 26,268 doses administered each day. Oregon has completed full 2-dose vaccinations or single-dose Johnson & Johnson vaccines for more than 500,000 people. Overall, 14% of Oregonians have been fully vaccinated, which matches the national average. Let's go to the next slide, please. Now let's look at where we stand in vaccinating seniors. As of yesterday, approximately 500,000 people 65 and older have been vaccinated in Oregon. That number represents 66% of all Oregon seniors. Includes 70% of people 80 and above, 71% of people between 75 and 80, 69% of people 70 to 74, and 60% of people 65 to 69. Let's go to the next slide, please. Nationally, Oregon now ranks 38th in the nation in percentage of seniors who've been vaccinated. We've made important progress. We knew there'd be turbulence, especially in the weeks that immediately followed the date a new band of seniors became eligible. We also knew that bumpy experience would smooth out over time as more doses became available and more people got vaccinated. And the sign-up challenges we saw seniors encountering in the early days helped us improve our notification and scheduling tools. We still have work to do, but I want to thank every older adult who has waited for an appointment for their patients while we worked through a number of difficult changes. I'm grateful you made the choice to protect yourself and the people around you by getting vaccinated. And for every senior who hasn't been vaccinated, I want to repeat the pledge I made when we opened vaccines to older adults. We have enough doses to vaccinate every senior. As of yesterday, Oregon vaccination sites have received approximately 1.6 million vaccines, more vaccines than the total number of people who are eligible. COVID-19 vaccines are safe and effective. Go to covidvaccine.oregon.gov and find out how you can get vaccinated. Next slide, please. Now let's look at the changes in eligibility dates Governor Brown announced earlier this morning. As you see in this slide, on March 29th, all people in Group 6 will be eligible to get vaccinated statewide. As you know, Group 6 includes as many as 800,000 people, ranging from adults 45 and older who have underlying conditions to migrant and seasonal farm workers to people displaced by wildfires. 22 counties began vaccinating people in Group 6 this week after they attested they were ready to move forward. This is not a change from the timelines we've announced previously. We're now advancing the timeline up 2 weeks for frontline workers and other people in Group 7. Frontline workers, younger people with underlying conditions, and people living in multi-generational homes will now become eligible to get vaccinated on April 5th. In keeping with Oregon's commitment to equity, this change gives frontline workers and other Group 7 populations more time to get vaccinated. It also ensures that counties that have seen a plateau in demand among older adults can make sure they can continue to keep putting shots in arms at a rapid pace. Everyone who's 16 or older will continue to be eligible to get vaccinated on a statewide basis on May 1st, as we announced last week, with one new change. Counties may open to all residents on April 26th based on an application. We'll ask counties to include an attestation that they're ready to move forward and to document their efforts to vaccinate previously eligible populations that they expect to have appointments available to expand sooner than May 1st. Counties must submit their applications by April 15th. We'll announce decisions by April 22nd. In counties that have been approved, everyone 16 and up could be eligible for vaccine as early as April 26th. Let's go to the next slide, please. As you can see from this slide, we're still expecting to receive enough doses to vaccinate every Oregonian 16 or older by the end of May. Based on these projections, we have enough doses to move frontline workers up to April 5th and give counties the option to expand eligibility to everyone by April 26th, if they can show they have appointment availability. Here are some of the highlights of the most recent allocation numbers that those projections are based on. For the coming week, Oregon will receive a total of 195,000 prime doses. Johnson & Johnson accounted for 24,200 of our state allocation total, which was a significant shortfall from what we expected. However, we do expect to see a jump in the amount of vaccines allocated to retail pharmacies through the federal pharmacy program. We expect the retail pharmacy allocation will grow from 47,000 doses to more than 56,000 doses next week. We don't know what the federal supply to pharmacies looks like going forward, but we believe the administration may continue to direct more doses to pharmacies. While our baseline Pfizer and Moderna allocations will remain stable next week, we did get a one-time 14,000 dose bump in our Pfizer supply, which allowed an increase in doses to mass vaccination clinics around Oregon. Going forward, we're still waiting for the full surge promised by the federal government. The week of April 3rd, we tentatively expect to receive at least 230,000 prime doses. Starting the week of April 10th, we tentatively expect that total to grow to around 250,000 prime doses per week, which we expect to continue into May. We've asked counties to develop surge plans to prepare for this infusion. At this time, we continue to distribute a vast majority of our state allocation on a per capita basis based on each county's proportion of people aged 16 and above. Finally, let me provide a quick update on more changes to our covidvaccine.oregon.gov website and our Get Vaccinated Oregon eligibility and notification tool. As of yesterday, approximately 550,000 Oregonians, more than 500,000 people, have registered at Get Vaccinated Oregon. As of this week, the tool now supports 10 languages in addition to English. Two important changes I want users of the website and the Get Vaccinated Oregon tool to know. First, the chatbot that's been helping people in the Tri-County area schedule vaccination appointments at the convention center and other locations will be discontinued. Going forward, all vaccination registrations and notifications will be handled through the Get Vaccinated Oregon tool, which also can be found at the covidvaccine.oregon.gov website. Second, beginning Friday, March 26th, the Get Vaccinated Oregon tool will no longer accept landline phone numbers as a method of contact. This change is intended to ensure that people do not mistake a call from a provider as a phone scam. There are approximately 200 people in the GVO tool registered with a landline as their primary contact and no other way to contact them. In addition, approximately 300 people provided a landline and some other form of contact. If you're one of those individuals, please update your account. Many people who registered in the GVO with a landline did their registration through 211. Anyone whose preferred method of contact is a landline can continue to call 211 for vaccine information. As we come to the end of March, I'm again struck by how far we've come as a state in such a short time. 1 million Oregonians have received at least one vaccination, more than 500,000 of whom are seniors. By early April, we expect to close in on having vaccinated 3 out of every 4 seniors in Oregon. We're on track to give every Oregonian access to a vaccine before the beginning of June. Next slide. However, our biggest challenges lie ahead. Getting enough people to take the vaccine. Right now, as we get deeper into the senior population, we're seeing demand slow in some counties. As this slide shows, the trend line on daily doses delivered is beginning to dip, not because of lack of supply, capacity, or urgency, but because we've reached 80% of our eligible populations and demand is beginning to plateau. Some counties remain below 50% of seniors vaccinated, and not because they don't have appointments open. Some of the counties that are furthest behind in vaccination rates are counties that conversely have had our highest COVID-19 infection rates. It's up to all of us to do our part and get vaccinated when it's our turn. Getting vaccinated is a way to keep ourselves, our families, and our communities safe from the virus. Once enough people get vaccinated, we will be free to further open up businesses and schools and keep them open. Get the facts, make a plan to get vaccinated. Go to covidvaccine.org and .gov for more information. Now let me turn it over to Dr. Seidlinger.
Thank you, Director Allen. I will briefly summarize the status of the pandemic in Oregon. Then I'll provide an important update on our surveillance efforts of variant strains of the COVID-19 virus. And finally, I'll turn it over to Dr. Melissa Sutton, who will give us an overview of the status of COVID-19 testing in Oregon. We continue to see a general trend of declining daily COVID-19 cases, virus-related hospitalizations, and positive test results as more Oregonians are getting vaccinated every day. This is also because of the work of all Oregonians in continuing to wear masks, gather more safely, and keep your distance. So I say thank you. Our rolling 7-day case average of new cases as of yesterday was 315. That's a decline of 73% since the beginning of the year and 52% since the beginning of February. Among US states, Oregon is fourth lowest in cumulative daily cases per 100,000 people. In our most recent weekly report for the week from March 15th through the 21st, OHA reported 1,920 cases, a 15% decrease from the prior week. As of today, we have reported 163,295 cases of COVID-19 in Oregon. Similarly, COVID-19 hospitalizations are also trending steadily lower. Yesterday, OHA reported 108 virus-stricken patients in our hospitals. That's a 77% decline in 2021. COVID-19 related deaths have also fallen. To date, there have been 2,373 COVID-19 related deaths in Oregon. My thoughts go out to everyone who has experienced a loss due to COVID-19. Among states, Oregon ranks 6th lowest in the US in daily deaths per 100,000 people over the last 7 days, and 5th lowest in cumulative deaths per 100,000 people. As this month began, 2/3 of Oregon's 36 counties were classified as extreme or high risk from spread of COVID-19. The paradigm has since flipped. The most recent metrics show that 28 counties had either low or moderate risk, and the resulting guidance has opened more opportunities for all of us. But that opportunity carries continued risk. Now I want to talk a little bit about variant strains. Mutations in the virus had led to the emergence of variant strains. Here in Oregon, we are fully invested in surveillance of the virus. Let me tell you a little bit about these efforts. There are 2 levels of classification for variants of SARS-CoV-2, the underlying virus that causes COVID-19. The first classification is variants of interest. These are variants with specific mutations that are predicted to affect how the virus spreads and can be detected or how it can be treated. The second classification is variants of concerns. These are variants with evidence for increased transmission or increased disease severity or evidence of an effect on testing, treatment, or vaccine effectiveness. To date, OHA has reported 18 cases of variants of either interest or concern, and we'll be adding a 19th case, another B117 today. Based on our observations, we are confident that the existing vaccines can effectively prevent severe infections resulting in hospitalizations and death. Nationally, Oregon ranks 5th in the US in the percentage of cumulative cases sequenced. Although that statistic is tempered somewhat by our middle of the pack standing and testing among states, we have a low % positivity indicating that sufficient testing is happening here in Oregon. It's an indication of the impressive surveillance that is taking place every day to stay informed and agile in our response to the virus. Presently, labs at Oregon State University, the University of Oregon, and at Oregon Health and Science University are sequencing SARS-CoV-2 genomes to detect and study mutations. I'm pleased to announce that the Oregon State Public Health Laboratory is adding that capability starting on Monday, March 29th. This will significantly expand our capacity to monitor changes in the COVID-19 virus, along with other diseases of significance. Finally, as Director Allen noted, this past week, we reached the milestone of 1 million Oregonians who have received at least one dose of COVID-19 vaccine. This is a truly remarkable accomplishment given where we stood just 3 months ago. It's a testament to the collaborative efforts Oregonians have been taking over the past year to protect themselves, their families, and their communities by wearing masks, limiting their gatherings, keeping physical distancing, washing our hands, and now, of course, taking the opportunity to get vaccinated when you're eligible. Your dedication and commitment are paying off, so thank you. And now, let me turn things over to Dr. Melissa Sutton.
Thank you, Dr. Seidlinger. Before I go into details of testing numbers and trends, let me reiterate OHA's commitment to COVID-19 testing. It is our duty to improve testing access for all people in Oregon and to directly provide testing to vulnerable and disproportionately affected communities. Since the fall-winter surge began, we have seen testing volume increase from approximately 70,000 tests per week in early October to a peak of more than 170,000 tests per week in December, a 2.5-fold increase. Testing capacity has increased dramatically, and the testing supply chain has stabilized. The amount of COVID-19 in the community, along with screening and surveillance testing, ultimately determine testing needs. As Dr. Seidlinger pointed out, we have seen COVID-19 cases fall dramatically. Correspondingly, our average weekly testing volume has also decreased to approximately 95,000 tests the week of March 14th. Since January 31st, Oregon's percent positivity, a reflection of both the amount of disease in the community and the amount of testing performed, has held steady at 5% or less. As of March 14th, our statewide percent positivity was 2.2%. We are doing an incredible amount of testing relative to the amount of disease in our community, and our percent positivity reflects this. However, testing access remains an issue for some people in Oregon, and bridging that gap remains a priority for OHA. In February alone, OHA offered 27 low-barrier testing events across 14 counties. And since the pandemic began, we have offered more than 200 low-barrier testing events and tested more than 23,000 people in Oregon. We will continue to offer these free testing events statewide. What does COVID-19 testing look like going forward? We will continue to offer Abbott Binax Now rapid point-of-care testing resources to clinical partners statewide, as well as public and private K-12 schools. We will expand our partnerships with community-based organizations to plan and support statewide low-barrier testing events with specifically focused testing of disproportionately impacted populations. We will facilitate testing of uninsured persons statewide through partnerships with healthcare systems serving vulnerable populations. We will launch a mail-in testing option for close contacts of COVID-19 patients under quarantine. This testing will be free to uninsured people and available to anyone who's unable to get tested locally. Lastly, we will increase our mobile testing capacity to provide testing where it is most needed. I'll finish today by reminding you that testing remains an effective tool in our efforts to curb COVID-19, but testing alone cannot control the spread of COVID-19. The two most powerful tools we have against this pandemic are basic public health interventions like masking, physical distancing, and avoiding social gatherings, as well as vaccination. I urge all Oregonians to get your vaccine when it is your turn. And now we are happy to take your questions.
Thank you, Dr. Sutton, Dr. Seidlinger, and Director Allen. And yes, we'll open it up for questions. And the first reporter is Galen Etlin at KGW.
Yes, thank you very much. Earlier this week, Director Allen noted some challenges in recruiting bigger pharmacies to add locations to the federal partnership program. I know 25,000 doses per week is the lost distribution potential there. Do we know why more locations are not signed on? What's the disconnect for those federal partners?
So to be clear, the large pharmacy chains themselves are signed up. It's the number of locations that we think can be expanded, and we're doing outreach right now to try to get more of those signed up. I suspect, as much as anything, it has to do with how many doses are available in the system, and that more locations will come online as more vaccine is available. But we're working to see what barriers there are that we can help with.
Great, thank you.
Thank you, Galen. And now we'll go to Kelly Assar at K2.
Thank you for taking the time. I appreciate it today. My question is about the number of vaccines. You guys made a mention today that there's a slower number of people getting or excitement around getting the vaccine. So why not follow suit with other states and open it up to everyone older than 16 who wants it to at least keep getting it in the arms of the community?
Well, we think that we're opening up eligibility starting Monday and then further on the 5th to a very large pool of people. And that'll help us move along much more rapidly through that population. And as I indicated before, these are populations that are much more at risk of contracting the disease. If they get sick, more at risk of serious negative outcomes. And so we really need to make sure that we have a good opportunity to work through those at-risk populations and disproportionately impacted populations before we move on to onto Oregonians at large. I'm confident that the volume of vaccines will pick up. And I should say we've plateaued, not dropped off in terms of vaccinations. Our daily average is the highest it's ever been right now. But that will pick up as we move to these large, newly eligible populations.
And if you'll allow me, I have one other question just
Sure.
about how we're going about getting these vaccines into the arms of people and how we stack up to other states. There has been some criticism that Oregon is a bit slower on the release of this vaccine and getting it into the arms of our community members than other states. What would you say to that, and what do you see for us in the future?
Yeah, I would say a couple of things. First, in terms of the percentage of vaccine that we've gotten out that we have, we're right almost exactly at the national average, sometimes a little below, sometimes a little above, depending on what day of the week you look at compared to when we got the vaccine. Also, in terms of the total number of people vaccinated as a percentage of our population, we very closely match the amount of vaccine that we're getting. If you look at states that are above us, most of them have gotten more vaccine per 100,000 residents than we have. And so I think we're getting vaccine out quickly. We just need more of it.
Thank you. I appreciate your time.
Mm-hmm.
Thank you, Kelly. And now we'll go on to Lisa Balick at Coin.
Good morning. I'm trying to find out, is there any plan to coordinate better with pharmacies for signups? I mean, so many people are still having to get on throughout the day to multiple websites to find appointments that suddenly pop up, essentially trying to still play the vaccine game. Obviously, there's a state, site where you can sign up and hope that you'll be contacted. But is there any way to coordinate better for so many people with all these appointments that are just popping up throughout the day?
Yeah, I think, Lisa, at this stage, we're committed to the system that we've got. We're at a place where it would, by the time we would get something more centralized set up, assuming that we could pull that off, we'd be to the place where that problem is not going to happen any longer. And again, like a lot of things, that's more a metro area problem than anywhere else. I've looked at places like Safeway or Walgreens in different parts of the state, and you can find vaccine appointments open for days. in those other communities. So I think this is just it's a function of where we are in the demand and supply cycle, and it'll resolve itself naturally before we could stand up some kind of a different system for appointments.
And a follow-up, you mentioned about the landlines not being used anymore. Is this same situation though still occurring with cell phone numbers where the number that comes through to try and reach someone is from perhaps a seaside or out of area number?
I'm not sure I follow the question.
When there were callbacks to people,
Mm-hmm.
in other words, on their mobile phones, it came up as an unidentified number for a callback for scheduling an appointment, or it came from an out of an area number, such as often Seaside, Oregon is what popped up and people didn't answer the phone at that point.
Yeah, I think we find that that's less common with cell phones than it is with landline numbers, and the volume, just the sheer volume of scam calls that go to landlines is overwhelming. It's one of the opportunities of working from home is to hear how often my phone rings in a day and how seldom it's an actual phone call for me versus a scam call. So you're right, it does happen. It's just much less frequent.
So what are people supposed to do at this point who are not still very tech savvy, especially in your senior population you're still trying to reach?
Yeah, so they can continue to call 211 and work through 211 to be referred to the call center at the Oregon Convention Center if that's where they're trying to get scheduled, or work with the folks at 211 to get scheduled at other locations.
Thank you.
Mm-hmm.
Thank you, Lisa. And next is Gary Warner from EO Media.
Yeah, hi, Pat. During your appearance before the House Subcommittee on COVID this week, you talked about the problems with the Johnson & Johnson vaccine and how you were really relying on Johnson & Johnson, since it's just one shot and that equals one vaccination, to move those numbers up, and that you were afraid that you weren't going to be able to reach those numbers without Johnson & Johnson. The final number I wanted to throw out is that you've fully vaccinated about 580,000 people, I think, statewide. It's estimated that you need to have enough vaccine for about 3.5 million people who are 16 and over. How does that all tie in together, Johnson & Johnson reaching those goals, having such a large group still to get to?
Yeah, so I think as I indicated to the committee on Wednesday, you're right. The Johnson & Johnson vaccine is a critical piece of the surge in supply the administration has led us to expect to receive. At this point, we think this is a question of timing rather than a question of whether the supply will materialize or not. And so we continue to project that we'll have sufficient vaccine to get to the place where we can have provided a first dose or a complete dose to all eligible Oregonians by early in June. But it's something that we're watching quite closely.
Do you expect that if Johnson & Johnson does respond well, that it's going to end up being the majority of shots going forward at a certain point that will count as the inoculation for an individual?
Well, that's a good question that I don't know that I fully have the answer to, at least can't. There are quantities of vaccine that the federal government has purchased from each of these manufacturers. There are still other vaccines in the potential pipeline. And most importantly, we don't have any vaccines, although some are now under trial, that are approved for kids. And I think the answer to that question of what will become predominant may well hinge on what vaccine or vaccines are approved for kids, because that's a good million individuals remaining to be vaccinated.
Thank you, Pat.
Mm-hmm.
Seeing that there is no more media questions, I'd like to remind our media partners that you could always send follow-up questions to our OR COVID-19.media inbox. Okay, and as I'm speaking, I see one follow-up question. Kelly Azar from K2.
Thank you, Delia. Thank you for taking another question from me. We've heard a lot of back and forth over the last, few months now about whether or not May 1st is a realistic timeline and date. Sitting where you are right now, Director Allen, do you feel like May 1st is a realistic date to have all Oregonians eligible for the vaccine?
Yeah, I do. I think, again, we continue to project that we'll have sufficient supplies available to vaccinate at the rate necessary to get there. If there are disruptions, then that'll be an issue if that occurs. We've done a lot of planning with how much vaccine we are capable of administering, and we're capable of administering vaccine through a variety of settings, some of which we haven't even tapped yet, to be able to hit that number. And so I think it does continue to be realistic. I think it's going to be a big push. I think a lot of people are going to be working really hard to get that done, but I think we can do it.
Thank you, Kelly. And next is Fedor Sarkin at the Oregonian.
Hello. Thanks for taking my question. So I'm curious, what goals specifically has the state set for reaching historically underserved communities with vaccines, and what are the metrics the state is using to gauge success in reaching these groups?
Yeah, I think the metric would be parity. Getting populations vaccinated at similar rates, regardless of their geography, their race, ethnicity, those kinds of things, and making sure that we're getting as thoroughly into those populations as we do in other populations. I guess I would add to that, if we find ourselves at a place where vaccine hesitancy becomes a major issue across the state, I would want to redouble our efforts to overcome that hesitancy, especially in those communities that are most at risk of contracting the virus and most at risk of negative outcomes if they get it.
And what other factors has the state found in that make it difficult for some groups to get vaccines? And what's the state doing to help overcome those barriers?
Yeah, so right now our numbers are actually quite good in the Native American Alaska Native population. They're quite good in the Asia area, in the Native Hawaiian Pacific Islander category. They're a little low in the Black African American population and significantly low in the Latina population. Big part of the reason for that is we're focusing so heavily right now on vaccinating Oregonians 65 and older. While the overall state population is 13% Latina, in Oregonians over 65, it's only 3% Latina. And so there's a strong headwind as we focus on the older population that's keeping us from reaching more of the Hispanic population. We've tried to offset that by working closely with federally qualified health centers, starting with 7 centers that particularly serve Latina communities. We've expanded that a couple of times and are now moving to all of the federally qualified health centers in the state. We're also providing them more flexibility to vaccinate more of the populations they serve beyond the eligibility definitions that we have now to try to drive that number. We've seen a little bit of improvement in our reach there, but that's part of why it's so important to have this next month of vaccination focused on Group 6 and Group 7. Group 6 includes migrant seasonal farm workers, other agricultural workers. Group 7 includes frontline workers. And those populations, unlike the senior population, are very disproportionately shifted toward communities of color, especially Latina communities. And we think that eligibility category by itself will help drive those numbers.
If I could ask one follow-up question. So when we talk about these communities, there are a lot of subgroups essentially, right? There's a lot of refugees who come from a lot of different countries, and each and every single one has its entirely distinct culture. So is the state reaching out to them individually and tailoring communication with those individual groups?
Yeah, I would say there are kind of 3 prongs to that. The first is we are working with a diversity of communications contractors to create multiple strategies aimed at specific populations and subpopulations, as you point out. Second, it's critical that we have local public health as our local partners because they work most closely with those communities. And so doses that get allocated to them focus on those populations. Actually, there are four pieces. The third is that we've got relationships and contracts with over 100 community-based organizations that are of those communities and work directly with people in them, and are trusted voices in those communities as a way that local public health can leverage its investments and the doses that it has to most effectively reach out to people. And then finally, the FQHC strategy is not limited to focusing on the Latina population. Those 33 FQHCs across the state deal with a variety of populations, including refugee and immigrant populations and others, to try to again be a trusted voice in those communities to overcome hesitancy and improve the rate that we're able to vaccinate.
Thank you.
Thank you, Fedor. And I'd like to remind folks, if you have a question, please, I am OHA host. And we do have a follow-up question from Gary Warner at EO Media.
Thank you again. We've talked a lot about eligibility today. Do you have a ballpark estimate when you could get all the Oregonians who want the vaccine vaccinated? And as a subset of that, does the state yet decided whether major events like, for example, the track and field trials in Eugene or the Pendleton Rodeo are going to be able to move ahead based on where we're at now?
Yeah, I'll take the first part of that question and pitch the second part to Dr. Seidlinger. We know that by the end of May, we'll have received enough doses to vaccinate all eligible Oregonians. We know we have the capacity to administer vaccines so that by the beginning of June, a week or two after we've received those doses, we've got the capacity to vaccinate all of those Oregonians who are eligible. What we don't know ultimately is how many of those Oregonians want to get a dose. And so I think that gap is what we're going to be working on, and that's why we'll be continuing serious vaccination efforts well after the beginning of June, because I think we'll need to overcome hesitancy for folks. We'll need to continue to do work we talked about earlier, reaching into hard to reach populations, one by one vaccines for homebound seniors, for example, those kinds of things. And so we'll have work to do beyond that, but we've got the administrative capability and should have the supply to be able to get people vaccinated early in June.
Thank you. And then the follow-up about major events.
Yep.
Yeah, thank you. I think, I want to go back to the kind of risk level framework we have in place here in Oregon. I think that has served us well in Oregon. We've seen our cases decline immensely, as has the rest of the country, but we kept our peak down lower than most other states, and we began our decline, our steep decline sooner than other states. And I think that's, a testament to the following the guidance that Oregonians have done, limiting some higher risk indoor activities, continuing to wear a mask, and getting together in smaller groups. We're continuing to look at that guidance, and most recently last week adjusted some of the outdoor capacity limits to allow more gathering outdoors, which is lower risk for transmission. And we'll continue to look at some of those capacity limits to see if we can allow some other additional lower risk activities to start. We anticipate that as more vaccines go into arms, that'll be an even bigger contributor to lowering the number of cases, and particularly the severe cases and hospitalizations here in Oregon going forward. And that's what we'd like to prevent, is complications and hospitalizations from this disease, even if we can't prevent every case of this disease. And so as vaccination rates go up, we'll hopefully continue to see those severe cases and overall cases go down, and not see a variant of concern or a more transmissible variant, or a variant causing more disease take hold here in Oregon. As we approach that, we've started conversations about what a framework could look like going into the summer and even through the fall, as we anticipate those cases will continue to go down. So I think we'll see larger gatherings being allowed to happen, particularly outdoors, likely still use of masks in some indoor crowded public places, and perhaps some outdoor places where people gather very close together. But hopefully in the next month, after some conversations with stakeholders, our local partners, and the governor's office, we'll see a framework that would allow even more of those outdoor events and even indoor events to occur at lower risk. But as I said, right now we're continuing to adjust those risk level frameworks, and we've seen more events being able to occur with the change in outdoor capacity limits, the Timbers and Thorns will start to welcome fans into their stadium in the coming month, and we anticipate other events will be added on as well.
Yeah, I picked two events, basically, they're about 3 months apart, that are these mega events. The Olympic trials in June, and then the Pendleton Rodeo in September. These are very, very large events. What is the likelihood that they're going to be able to occur, or are you planning on limits on something like the Olympic trials?
I will say, I think, I cannot fully predict the future, so I won't give definitives, but if we continue on the trajectories we're seeing right now, while our cases have plateaued, overall, we're in a much better place than we were through the end of last year and the beginning of 2021, with cases having come down significantly and not seeing variants of concern taking hold in Oregon as they have in several other states, and particularly in other countries across Europe, for example. So if we can continue to get vaccines out, continuing to see those cases hopefully start to decline as those vaccines come out, I think those events will be allowed to take place. Again, outdoor events where people can spread out a little more, where we have the advantage of dispersion of the virus into the air, carry much lower risks. So I would anticipate that those events would be able to go on, and that we will have guidance for how to guide those events coming out in the next month so that they can plan, because we know it takes a tremendous amount of planning and many months of planning for those events to go on. And that's why we're working towards coming up with a framework that, barring any significant changes in disease activity, vaccine availability, or other things that could change the trajectory here in Oregon or in other states, that we all have guidance for them to put on those events with low risk for the people participating in those events, as well as the spectators who want to come watch them.
Thank you very much.
Thank you, Gary. And the final question for today is a follow-up from Fedor Sarkin at the Oregonian.
Hello, thanks for letting me ask another question. So as we discussed, the groupings, race, ethnicity are broad, right? And separately, my understanding is that the metrics to gauge success are % vaccination in these different groups, right? So I just want to make sure that there aren't other metrics or other ways that the state is measuring whether everybody is being reached, right? Or if, and also separately, you mentioned that the data, at least right now, is skewed, right, because of the priority groups. So essentially, the data is somewhat skewed and can be skewed, and the groups are very broad. So are there other ways that the state is measuring to find out if all those efforts that you described are successful?
Yeah, I'm not sure what other methods you have in mind. I would maybe say that the data isn't skewed. The data is accurate. The populations are skewed, and so we're vaccinating through populations that are less communities of color than the populations that are coming up. I think really, Fedor, at the end of the day, the metric really is that parity metric of have we gotten as much vaccine, as many people vaccinated in all of our communities as we have from a statewide standpoint, and not try to use a statewide average to mask lack of vaccination in other communities.
Thank you, Fedor. That's our final question for
Delia,
today.
I can provide a little late breaking news. The CDC website just updated, and for at least a first dose for seniors, we've moved up to 35th in the country. So you can see we're continuing to improve our standing based on the rate of vaccination right now.
Thank you for that update, Director Allen. And with that,